The treatment of leptospirosis is rather simple. If the illness is mild, start the treatment very early, if possible within the first 5 days itself. But if we are delayed due to some reason, there is no harm in starting treatment after the 5th day also, because there are studies to show that late treatment also does have a good beneficial effect. It is better to start as early as we consider leptospirosis. The treatment for milder illness is oral treatment for 7 to 10 days. The drug of choice is doxycycline 100 milligrams BID twice a day. The other drugs available for us for leptospirosis are amoxicillin 500 milligrams 4 times daily or ampicillin 500 milligrams 4 times daily for a period of 7 to 10 days. Of course, other general supportive measures like bed rest, fluid intake, analgesics, antibiotics, all these things are required. In severe illnesses, start the intensive treatment as early as possible without waiting for the results also. IV treatment should be started and it should be given for a period of minimum of 5 to 7 days. Penicillin G or benzyl penicillin, also called crystalline penicillin, is the drug of choice for leptospirosis. 20 lakhs 4 times daily for adults. For children, commensurately lower dose. For any reason, if we do not give benzyl penicillin, we can give ampicillin 1 gram QID. In patients who are allergic to penicillin, erythromycin can be given QID. Third generation cephalosporins like ceftriaxone 1 gram OD or cefotaxime 1 gram 3 times a day are also very efficacious treatments. In a recent randomized trial, the comparison of ceftriaxone to benzyl penicillin, the results are equivocal. Both of them are having equal efficacy. So, for severe illness, parenteral treatment 5 to 7 days, IV antibiotics, benzyl penicillin first drug, ampicillin, ceftriaxone or cefotaxime or other agents. For milder illness, doxycycline is the first drug, amoxicillin, ampicillin, erythromycin are the other agents that are available. Remember one word about Jarisch-Herxheimer reaction. What is Jarisch-Herxheimer reaction? When we start the patient on antibiotic, within a few hours, patient may develop a flu-like illness with myalgia, headache, rash, and then sometimes weakness, hypotension. All these things can occur. This is due to the organism being attacked by the antibiotic. When the antibiotic acts on the microorganism, the toxins from the organism are released and they produce this sort of reaction. This shows that the patient is responding or the pathogen is susceptible for the antibiotic. It is little cumbersome and unpleasant reaction, but treatment should not be discontinued if we see Jarisch-Herxheimer. This Herxheimer reaction subsides with supportive treatment and the treatment has to be continued. Fortunately, this is not very common in cases of leptospirosis, unlike in certain other illnesses wherein we use benzyl penicillin or ampicillin to treat the offending agent. Patients who have involvement of the different organ systems, they require some special measures. Severe illnesses of leptospirosis, the cases require intensive care, monitoring of all the vital parameters, renal function, hepatic function, cardiac function, and cardiac care, particularly in patients with carditis, myocarditis, and hepatic care for those who develop jaundice and who have severe features of hepatitis. Fluid balance, particularly the correction of hypovolemia and bleeding, addressing the bleeding issues. Platelet transfusion may be handy, or if necessary blood transfusion may be required. If the hypovolemia is there, the patient is having hypotension, then we may require even whole blood transfusion. Platelet transfusion when there is bleeding tendency and thrombocytopenia. If the renal function is showing deterioration, Some patients may require dialysis. CNS complications need to be addressed. These are some of the special measures required in cases of severe forms of leptospirosis with multi-organ involvement. The prognosis of a given case of leptospirosis and the mortality depend on whether the patient has got renal involvement, whether the patient has got myocarditis with cardiac dysfunction, whether the patient presents with bleeding tendencies, thrombocytopenia, vasculitis, and particularly endothelial damage. Pulmonary manifestations like aseptic meningitis and hemorrhagic pulmonary manifestations, and of course aseptic meningoencephalitis picture. If the patient of leptospirosis has got either one of these, any one of these manifestations or a combination of them, certainly the prognosis for that patient is rather poor and we may end up in mortality, and usually the mortality for such patients is around 10 to 15%, and in some areas like Kerala, as high as 40% of patients of these manifestations, they succumb to the disease. How do we prevent? What are the preventive steps that one can take to control leptospirosis and its spread? Prevention is rather difficult. This is because the wild animals have the infection. We can't go and vaccinate the wild animals or control the wild animals. From the wild animals, the other animals like domestic animals, rats, cats, pigs, cattle, they get it. So much so the prevention as a whole is a difficult process. Good sanitation is an important integral part of preventive programs, and keeping the environment clean and not allowing the domesticated animals to urinate in water that is going to be used by human beings or with which the human beings come in contact. We have to avoid animal contamination of such waters. But unfortunately in our country, the same pond, the livestock are washed, the dogs are washed, and there the people take a dip and take bath. So much so the contamination is a grave possibility. Immunization of livestock is a possibility. Vaccines for the livestock are available, but again they are serovir specific, and it's difficult to vaccinate for all the serovirs. Personal hygiene of the individuals who are particularly occupationally exposed or recreationally exposed. They must wear personal protective equipment such as rubber boots, gloves, face masks, and then they should avoid contact with animal excreta and contaminated water. The other thing would be water treatment, because this organism is highly susceptible for acidification and for chlorination. It's important that if we chlorinate the water reservoirs or water sources, obviously we can reduce the impact of the illness. Unfortunately, we don't have a very useful human vaccine for the disease. This is with the background that we have around 250 serovirs. If we develop a vaccine for one serovir or two serovirs, it will not work for the others. That is the reason the human vaccines are not available as of now for public use. The vaccines are very painful. They produce fever and local sepsis and tenderness in the muscles. So much so, we don't have a potent vaccine or useful tool for human beings. If we know certain groups of people are at high risk for a short period of time due to their occupation, then of course we can protect them by giving doxycycline 200 milligrams weekly as long as they are exposed to the risk, and for those high risk groups this preventive measure can be applied. So these are some of the steps in the prevention of leptospirosis. So dear friends, this is all about leptospirosis in nutshell. This is the current state of knowledge. I again reiterate the fact leptospirosis is becoming an emerging infectious disease of importance to us, particularly in our country, the tropical climate. It is the most important worldwide zoonosis. One has to have the suspicion to think about the disease, the two common forms, the enictric form and the ectric form. Enictric presentation, majority of them they recover and then it's very mild. The ectric form, it could be severe, it can be fatal. The treatment for the milder form of the disease is doxycycline and of course the other antibiotics like ampicillin and amoxicillin, erythromycin, that orally given for a period of 7 to 10 days. The treatment for the severe illness is parenteral intravenous antibiotic, benzyl penicillin, 20 lakhs 6th hourly, or ampicillin or amoxicillin, or third generation cephalosporins like ceftriaxone or cefotoxime. The most important aspect of the severe illness is the multi-organ involvement, renal, cardiac, pulmonary, meningeal, vascular involvement, the typical vasculitis picture and the bleeding manifestations. One need to take care of those aspects to reduce the fatality. We don't have much of preventive options except for personal protection, and of course in high risk groups we can give them doxycycline 200 milligrams once weekly. With these things, I would like to remind you about the Fain's criteria to clinically suspect and diagnose the disease, and also to use the various tests. Among the tests available, we have the blood culture and the PCR, which are not handy for clinicians because of the factors like the delay in the blood culture or the cost factor in PCR. The other tests which we have are the ELISA, the SAT test and the MAT test. Among them, ELISA and SAT are commonly available. They can be used with great help from the laboratories, but of course the MAT test is not readily available, and the interpretations of these tests have been discussed. With these important take home points, I close my talk on leptospirosis, and I thank you all very much for your patient listening. Thank you one and all.